Right, ladies and gentlemen, welcome back. Thank you very much for staying tuned to PTV World. You for sure watching World this morning alongside Miss Mahim Jaffrey, and I happen to be Shahzad Hassan Khan. Earlier, obviously, we were talking about food security and insecurity at times. But ladies and gentlemen, I think that the only insecurity I've always lived with, God forbid, I think it's always in my mind, and that is that, God forbid, yaar, I don't know, mera dil sahi chal raha hai ki nahi chal raha. I go to the gym, I work out, everything's fine. But as soon as I'm on the bed, I'm like, okay, I don't know. You know, there's something wrong. So, you know, anxiety and all of the things might add to that as well. But today, obviously, before heading out towards the short break, I said, you know, is it okay for your heart to be in love? You know, then do you think that your heart's going to be in a great place as well? Yeah. But that's not what we are discussing today. I'm sorry for misguiding you for a little bit, but I think that was a lighter moment in the show. But today, ladies and gentlemen, a lot of newborn babies do have a lot of complications related to their hearts. And that's something which we are talking about, whether those are treatable or not. And God forbid, if we have to worry about, what do we really have to worry about as well? And what are the most common cardiac issues which we might see or come across within newlyborns as well, or neonatal? That's how we refer to it. Ladies and gentlemen, today to talk about that, we're very lucky that we've actually been joined by somebody who happens to be a congenital cardiac surgeon at Maroof International Hospital. She happens to be Dr. Mahim Malik. Hello, assalamu alaikum, good morning, how are you?
Good, thank you so much for having me.
Thank you so much for joining us. Wonderful to have you. A very unprofessional question right at the beginning of the show, and that is, if you are in love, do you think that your heart health is going to be better? You know, just
definitely.
Thank you very much for saying that. So what are the most common issues we see in the newly born babies when we talk about heart health?
So I think that, you know, heart disease in children is a much ignored problem. When you talk about all the defects that children are born with, heart problems are the most common ones. And if you were to ask me to put a number to it, I would say about 0.5% of kids that are born with a heart problem.
Heart issue.
Right. Yeah.
Right. And what are the most common ones?
So there's a whole spectrum of diseases. The most simplest ones are, you know, what we hear people say, "Ji dil mein surakh hai," and you know that could mean anything. That could mean a small hole that's going to close on its own, and that could mean a problem that's a really complex one, and the hole just happens to be a small part of the whole spectrum of what's wrong with that heart.
And I'm sorry for giving this example, you know, but it's just like, you know, when you go to a probably car dealership and, you know, you have ordered a new car, they would always make sure to check in, and, you know, they would always take their client alongside and be like, sir, dekhe, har cheez puri hai. You know, even within hospitals, I've seen that there's this culture that whenever there's a newborn baby, they will always make sure to take all the tests and whatnot. True. But then there are certain places, or, you know, there are different places, different practices where people just do not pay attention to any of this, and they would take the baby back home, God forbid, not knowing why his lips are, or her lips are turning out purple, or probably why they're out of breath. And, you know, there have been so many other issues as well within cousin marriages too.
Adding in this question, Shahzad,
you like to add,
important.
Right?
Yes, I always love to add, especially when it comes to you. So, talking about factors, what causes this? Is this genetics or the environmental factors when, you know, the baby is inside the womb?
No, because we're talking about a newborn baby, I don't know whether it's going to be environmental, right?
So I think that, you know, you've touched on two things. True. I think first I would say is, what do you think about? So I think that, you know, if you were to talk about the developed world outside of Pakistan, you know, the high-income countries like the US and Europe, all of those mothers who are pregnant, expecting mothers, get regular ultrasounds, right? And they get what's called an anomaly scan.
True.
And, you know, the sonographers over there are trained to pick up certain abnormalities in the heart at that stage, when the baby's still in the womb at about 22, 24 weeks, right? And if they find something over there, then they refer to a cardiologist even before the baby's born.
True.
And then the cardiologist will do what's called a fetal echocardiogram, meaning the baby is still inside the mother, and they do an echo, like the way we do it with adults. It's the same thing, but they do it while the baby's inside, and they're able to pick up most of the complex problems at that time. And then once they know what's happening, then the mother's taken, you know, the delivery happens in a center where they're ready for these things.
True.
What happens in our situation is that these are not picked up. And unfortunately, like you said, you know, they just send the kids home and nobody knows what's wrong with them, and they're just discharged, and, you know, the baby's born. Hopefully the baby is born in a hospital. A vast majority of our babies aren't even born in hospitals, you know.
Even today?
Exactly. So that's still a problem, and they never get picked up. So I think that's key, where when a child is born, the pediatrician at that point, even the obstetrician, should be trained to pick up certain abnormalities. One of the most common ones being, is the child blue?
True.
right? And then when they listen to the
fingers,
child,
the nails,
right,
the lips,
absolutely,
yes.
the lips, yeah. And then when they listen to the child's heart, which almost nobody does, are they able to pick up a sound that sounds abnormal, right? Which is not what a normal heartbeat sounds like. And that is key, where they need to pick up abnormalities. And the part that's a little sad also is that a vast majority of these problems can be fixed with surgery, and these children can lead a normal life and be as productive as you and I. Hopefully we're that productive, but
I hope so.
right, so can be productive members of society. And it's not like they have a heart problem, that means they can't do anything for the rest of their lives. So I think that's key.
And you know what, those surgeries are very risky too as well at times, and people, they really want
normally
to go
scared of
outside
that.
Pakistan for such sort of surgeries as well. But very quickly, because you actually kind of touched upon a very important point over here, so we might have progressed technologically when we talk about the field of medicine. But with ultrasound, I don't know, why aren't we kind of getting anywhere? Because unfortunately, I've gone through a situation where somebody picked up in an ultrasound that my baby, God forbid, will have Dandy Walker syndrome,
Right.
where the brain is not attached and they cannot sit
Absolutely.
and whatever. But alhamdulillah, the baby came out to be fine. And so over here, the technology does not tell them that, hey, you know what, there's something wrong, but they on their own tell the people, hey, you know what, your baby's not fine. And that actually scares you quite a lot as well.
Scary.
So the reason for that is that ultrasound is a very operator dependent test, right? So it's not like a CT scan, which is like a picture. So the ultrasound is going to depend on the
Andaza.
person, the one who's holding the probe, and what he or she sees, and what they know to pick on.
True.
So I think
But they
that's
know to pick on.
right. What they know, this is what this is supposed to look like, and so I think that's entirely the problem. That's why even though we do scans in pregnant mothers, but mostly these heart diseases don't even get picked up because they don't know what they're looking at.
Exactly, that's true. And God forbid, when they're not picked up and when the babies actually show up at your clinic, obviously you really need to kind of take actions immediately as well. And for the family to decide is important and a difficult task at that moment. So number one, for all of those, God forbid, illnesses, which you just mentioned as of now, are they treatable? Can we treat them over here within Pakistan?
And not get scared.
Can you help people, God forbid, if their kids are suffering from that?
Yeah, so I think that there's a whole spectrum of diseases. There's some kids who are born with that problem, but they don't need treatment till they're 4 or 5 years of age.
True.
There are others that don't get any treatment for whatever reason, and I operate on kids who are 17, 18, even 20 plus years of age. So they've made it through their life with that problem, and more or less
Without
okay,
any
right?
complexity.
Yeah, and they have some complications obviously because they've lived with the problem for so long, but they've survived to adulthood where they still get surgery. Obviously, it would have been better if they'd gotten treatment when they were younger, but they still make it to adulthood. But then there's those kids that are born with that problem that don't have that kind of time. They can't wait for somebody to randomly pick up what their problems, and those are the ones that we need to pick on. So I think that's what, when you mention neonatal and infant cardiac surgery, meaning within that first month of life, or within the first 2 months of life, and up to a year, those are the really small babies that need treatment. So that's what we do, that's what I do, that's what my special interest, or you can say what's close to my heart is. I like to I try and do I like to
Help.
do help little babies as much as I can, and it's very high risk.
That's
It's
wonderful
very high
as well,
risk,
but
yeah.
I like it where you said that you've operated on kids as old as 20 years old as well. I think I fall in the same category. But yeah, it's wonderful. Referring to a 20-year-old as a kid, it's wonderful as well.
So coming back to your question or your explanation, when you were saying that you like or you enjoy doing that, those are so complicated and delicate processes. How do you develop the protocol in the baby, operating a baby? I mean, even listening to it, scares many people off.
So I think it's a number of years in training. People ask me how long it took me to get here, and I can tell you I trained for 10 years.
Okay.
Right. So
Mashallah.
after I graduated from medical school, I spent a long time in
Went
residency.
to Afghan, right?
Yes, I did
Wonderful
go to
school.
Afghan. Yeah. So then I went abroad, and I spent a long time training and in residency to get to where I am today. I think that's, and even now, even though I've been out of training for a good 5 years now, but this is still kind of a learning phase. You learn something new every single day. So I think that it's complex. There's no doubt about it. But what the surgery is just a part of that puzzle. So there's pre-operative workup. Was the baby sent over on time? Were they handled appropriately before they made it to surgery? And then what happens to the baby after they undergo surgery, right? So that's a big part of all of this. This is where the ICU care and all of those things come in. So that's equally important when it comes to taking care of these little babies.
And just to kind of come back to where you said that, God forbid, there can be complexities, God
Right.
forbid. But when we talk about such treatments given to babies, so then they recover 100%, alhamdulillah, live a healthy life, and
Yes.
are
Yes, and I think that's one of the most heartening things for me, right? So even today, a couple of days ago, I got a picture of a baby I'd operated on 4 years ago when I first came back to Pakistan, and he was a month old then, and now he's almost 4, and he's
mashallah,
running around, and the cardiologist will send me pictures of these kids.
Such a happy day for you.
Right, that are now growing up and they're doing so well. So I think that kind of makes that risks that we take, and that complexity and all that heartache and all that stress that I take when I do
kind
it,
of compensates
that makes it worth
and just a couple of questions, because when we talk about babies, so their heart rate is faster, right? So their heart rate is not as of an adult.
Right.
And God forbid, when you're operating on babies and the heart rate's already so faster, don't you just at times panic and be like, hey, you know what, things are getting out of my hand? Obviously, the training does play a role.
Right, exactly. So I was going to say, so that's what you're trained to do, right? So if
Yeah.
you've been taught to do things in a certain, that's when it comes in. So if you were, I'd flip roles and say that sitting where you are, somebody else would be very uncomfortable.
But you're doing a fabulous job today.
with where you are. So it's one of those things. It's what you're trained to do, I think, and what you put your mind to.
And just talking about to what extent we do use technology, because so I don't know how we refer to it. I've heard about open heart surgeries and stuff like that. With babies, is it different? Is it keyhole surgeries? And do you make sure that?
No, so I do open heart surgeries. Which
babies?
is, because some of those are so complex that the keyholes are in small kids, that hole is small enough to count as it's almost the size of a keyhole. But that's what we do. But there are people who do, who take complexity to the next level, where they'll do even smaller incisions. So I don't do those, but I just, it's almost impossible to do that in small
Such an
babies.
amazing job you're doing.